This is a trying time for many people. Whole lives have been turned upside down. It's about time we start a conversation about what this is doing to the mental health of many people. So with us today, we have Shauna Reitmeyer, Chief Executive Officer at Northwest Mental Health, to talk about these issues and try to help us find a solution. Thank you so much for joining us today.
Thank you.
I feel like all of us can admit to having a little more anxiety, and yet I think we also all know someone who is really super stressed about what is happening right now in our world. Can we just start with what kind of impact COVID-19 is having on people's mental health?
Certainly. COVID-19 is bringing uncertainty to many people's lives. And when there's uncertainty, people become uncomfortable. And when people are uncomfortable, it can lead to anxiousness or fear. There's a lot of information that's out there right now, and it can almost have a traumatic reaction. So that fight, flight, or freeze mode that people get into. And so that uncertainty that people have just can cause that added stress and that discomfort that leads to fear. And then for people that have mental health issues going into COVID-19, this need to be in this physical isolation from people and away from connection with people can also exacerbate existing symptoms and illness that people may have.
That's a very good point. Sometimes you feel like you're alone when you really are supposed to be alone. We're talking about self-isolating and social distancing. Is there anything you can do on your own? We'll kind of break down the difference, what you can do, and maybe when you need to seek help and what kind of help that might entail.
Certainly. So one of the things that, we talk a lot about now that we are needing to be in our homes, the daily routines that we've had are disrupted, is to start creating a new structure, a new routine that you'd had that you don't have now. And so an example is if you're working from home, get up, get ready for your day like you would as if you'd gone to the office. Get dressed, do your hair, and create structure and create those routines and stay informed with trusted sources. So you're focusing on facts, not fear. And don't forget to take care of yourself and your body. Eat well. We can still go to grocery stores. We can still get healthy food. And so staying well, staying hydrated, limiting the amount of alcohol that you're in consuming during this time, and focus on those things that you can control. And that is what's within your home, within your environment. You have that ability to control that when you can't control other areas. And I think of our healthcare workers and correctional facilities, treatment providers that are on those front lines and working with people every day. Those basic needs of eating and staying hydrated and sleep is really important, but take breaks where you can as well, and check in with leadership to get the support that you need within that environment. And if you find that creating those structures and you start ruminating on fear or getting anxious, and strategies such as meditation, journaling, talking with trusted supports and staying connected through video or FaceTime or Skype or Zoom. And those things don't help alleviate that fear or that worry that you have, then that might be time to reach out and get some help from trusted sources.
And expanding on that, what are you guys doing to help kind of accommodate people who need to reach out and get a little more help?
You bet. So Northwestern Mental Health Center has done a lot of work to transition all of our providers to be able to see people through telemedicine. And we're even doing some telephone work as well. So if people don't have the technology in order to connect, we can talk with people over the phone. We can see them through telemedicine. And if people don't have any of those resources, what we're doing is still keeping our clinics open in Crookston and the East Grand Forks are our main clinics that a person can come to our office, they can see a provider through a video connection, and still get those services. So many organizations across the region are continuing to see people and encourage people to reach out for help when they need it.
That is great news in this time right now when maybe more people will need to reach out. Thank you so much for visiting with us, and great information. I appreciate
You're
it.
welcome.
Stay with us. Coming up here on North Dakota Today, you might be starting to put on the quarantine 15. Pandemic pounds are a real thing, and our next guest might have a solution. Stay with us.